So our patient's X-ray, the airway seems to look all right. Our breathing, it seems to look normal. Cardiac, I don't see abnormalities there. Under the diaphragm, down below looks okay, and as far as everything else, I reviewed this, I didn't see anything beyond that, additional findings, so I would say this reads as a healthy, normal chest x-ray.
Okay, so your interpretation is that it's a normal chest x-ray?
Yes.
For the patient we just reviewed on rounds?
Yes.
All right, so you did some really, really good things. I like your systematic approach.
Okay.
The A, B, C, D, E was very good. Do you always follow that systematic approach?
Yeah, I try to.
That's very important. So I really like that you did that,
Okay.
and that you actually marked things out.
Okay.
That was very good. Let's work on making things even a little better
Okay.
as you mature in your learning. The airway, when you're giving details about it, say what the right main stem, the left main stem looks like.
Oh, okay.
B, I could tell that you were looking back.
Yeah.
You were looking at all lung fields, I would assume. Okay, very important. Mention whether you see infiltrate, effusion, atelectasis, a mass. Mention that, because if you tell me that it's not there, at least I know you looked for it. Whereas if you just say it's okay, can I interpret that you actually looked at all those things?
That's a good point. Right.
Okay, good. C was good, this cardiac silhouette is okay, but make sure you also mention some details about the size of the heart, whether there's cardiomegaly or not,
Okay.
the aorta,
Yep.
things of that sort.
Okay.
D, the diaphragm's good, you marched them out. Give me details about the costophrenic angles and specifically what you see under it.
Okay.
And E, you're correct, there was nothing extra in the patient.
Right.
So, did you get to read the whole chapter?
He didn't. We had a tough night with calls and consults, so he didn't read it all.
So, I need you to figure out a systematic way to, as soon as you get home, do some sort of reading. Give yourself a short period of clock, something doable
Okay.
every day. Figure out what works best for you and try to read, because being able to read this is being able to save the patient.
That's true. Yeah.
And I know that you try in everything else that you do from what I've seen, so I'd like you to just continue trying hard with your reading.
Okay.
But for the first time I've read a film with you, you seem to really try to have a thorough approach.
All right. Thank you.
You're welcome.